So what happens when you miss the target? Okay, we're talking about ultrasound guided versus landmark injection accuracy. And I want to be honest, when you inject without ultrasound, you're relying on surface anatomy, experience, and hope. Okay, and hope is not a clinical strategy. Research shows that landmark injections miss the intended target about 30 to 70% of the time, depending on the joint. And that's really not a small margin. Okay, that's a coin flip with your hand and a needle in it. Okay? There's a part that clinicians rarely say out loud, but they absolutely feel. Many of the orthopedists we work with, who are literal surgical anatomists, openly admit that a lot of their blind injection over the years probably missed the mark. And this is not because they're unskilled. It's because the technique itself is limited. Okay, just this week, a client texted me from the airport after training. Okay, and she said, I was talking to so she's in the emergency medicine doctor. She was talking to her emergency medicine friends who she trained with pre-ultrasound, and they all laughed at how much we were the Cowboys in the field. Instead of roping a huge field with a large, strong lasso, it's now a technique of using a fine thread needle in a very small area. So that's the shift we're talking about. Okay, we're talking about from cowboy medicine to precision medicine. And when you miss the target, okay, it's not a harmless mistake. Okay, it can have real consequences. Okay, when the biologics, the cell therapy, the platelet-rich plasma, medication, it ends up in the wrong tissue. Okay, the things get wasted. Okay, the pathology never receives the therapy, recovery slows, the pain increases, inflammation persists, and yes, the risk profile climbs. So missing the target is invisible harm. Here's what people don't talk about enough. Ultrasound guidance isn't about being fancy or high tech or doing something like extra. This is about being accurate, ethical, and predictable. If you're doing PRP, viscosupplementation, nerve hydrodissections, or any other regenerative medicine procedure, the real risk isn't using ultrasound. It's not using it. When you inject blind, you're not just guessing where the needle is. You're guessing where the medication's going. You're guessing whether the patient's going to get better. You're guessing whether the treatment will work. And you're guessing whether you're going to sleep good that night or not. Okay, so it's 2026. And with technology we have, okay, guessing is no longer defensible. The best part, clinicians feel the difference immediately. Okay, that same client ended the message with, if anything, this challenge has been laid out and I'm going to master this. I'm just going to start calling you Obi-Wan. That's what happens when somebody finally sees what accuracy feels like. They stop hoping. They're going to start knowing. Okay, learning ultrasound is far easier, far faster than what most people think. With the right instruction, the right reps, of course, the right feedback, precision becomes second nature. Okay, that's the difference between a procedure and a predictable outcome. And we're about predictable outcomes.